Mr. President.
Senator from Alaska is recognized.
Senator from Colorado, thank you very much for the presentation, especially on small business, the impact that it will have. I want to step it to one degree, and that is because I think you've done a great lay of the land of the impacts of small business, I want to step it up and talk about, because I sat here and listened to several of my colleagues on the other side, the Republicans, talking about what's going to happen if we don't do something or if we do health care reform. So I want to talk about at least one myth that I hear over and over again from the other side that will impact small business, but impact everybody. And I'm also pleased to join my fellow colleagues here and talk about the importance of health insurance reform. The myth I want to talk about today that I have heard over and over again, the scare tactic words that I think belong in the soup lines of the Great Depression. It's rationing. Opponents of health insurance reform have recently resurrected the word to suggest that Americans will get less care when reform legislation passes. Is there anything more cynical than that? Telling Americans that their health care will be rationed because of reform, that they'll lose or get less care when Congress and the President finally take action? The defenders of the status quo ought to be embarrassed. They know the opposite is true. The more Americans will have access to more care when reforms are finally adopted. Rationing is not some roadblock waiting down the road for the vast majority of Americans. It's what's happening right now. Let's use my state as an example. A state that 52% of the folks employed are from small business. When I came into the Senate at the start of the year, the Census Bureau said 123,000 Alaskans were uninsured. But new data came out last month, just a few months after stating that statistic. Now that number is up to 133,000. In other words, 10,000 more Alaskans have been rationed out of their coverage. Insurance companies no longer carry them. Unable to pay the skyrocketing insurance premiums, or maybe their employers no longer can afford it, as laid out so well by the Senator from Colorado, of business people who are struggling to ensure that their premiums can afford them, that they can afford them for their employees. Or they've been rationed out of the system because they have to switch jobs. Then when they apply for new insurance, they are disqualified because of pre-existing conditions. Or the annual cap on how much the insurance company will pay is so low that people get sick and hit their limit early. From that point on, they can't afford to see a doctor for the rest of the year or ensure that their coverage or their quality of care is maintained. This is another form of rationing, and it's real. By one estimate, 14,000 Americans lose their health insurance every day. These are friends and neighbors and loved ones, and it's inexcusable. Maybe the reason for rationing is even more outrageous. The cases where insurance companies revoke coverage through a practice called rescission. Unfortunately, this is very real. A report by the House Ways and Means Committee says insurance companies saved themselves $300 million over 5 years through this practice of rescission. So again, let's put the word rationing in proper context. It's the status quo, and its insurance industry is making lots of money because of it. Now let's talk about what will change when we pass health insurance reform. As you can see on the chart, reform will be easily take care of many issues that Americans face. Tell insurance companies they can no longer deny coverage because of pre-existing conditions. Stop them from setting low annual or lifetime caps and refusing to pay the care after that. Reform will offer Americans more choices by creating health insurance exchanges, as so well described by the Senator from Colorado, as I like to call it, is health insurance Expedia. As we do with travel, we can do it with health insurance. And it will require insurance companies and Medicare to pay for more preventive care so people can regular checkups and screenings. This means we can recognize and even prevent oncoming chronic illness. Of course, this is better for the patient, and it saves us money. Mr. President, let me say it again. The scare tactics of so-called health care rationing is just that, a tactic trotted out by those who want to kill reform. The truth is, health insurance reform will give Americans more. More people will have more access to more health care. Thank you, Mr. President, and I yield the floor.